All right. Good evening, everyone, and thank you for joining us this evening. I want to do some introductions of who all is on the YouTube event this evening. We have our superintendent, Dr. Kaligian, and her cabinet. And then we also have our guest panelists who I'll take a few minutes shortly to do some brief introductions. We have a lot to cover in the hour that we have together, and I want to get started and be mindful of everyone's time because I know there's a lot of questions and concerns that folks have, and we have a phenomenal opportunity with the medical experts in the room. So first, I wanted to walk you through the way to use Thought Exchange. So, Angela, if you want to give just a little description, that would be perfect.
Absolutely. Thank you very much, Ms. Kay. And what we're going to do is put on the screen in just a moment instructions for participating in the Thought Exchange. I know many of you have done this before, but if you're new to Thought Exchange, it's very easy. Basically, what Thought Exchange does is it allows you to ask a question for the panelists, and then your question gets put into a queue. You're then able to see not only the question that you submitted, but then you're also able to see other people's questions, and then you can rate them. So imagine if you were looking at a Yelp rating or Amazon reviews. Similarly, you're able to go through not only the comment that you made or the question that you made, but you're able to also see other people's as well and rate them. So we're going to give you lots of time to get logged on, and bear with us as we're going ahead and we're sharing our screen to give you the information for the Thought Exchange. But what I can tell you to do right now in preparation is to have a couple of things ready. You can have your cellular device, your phone, and you can even have a computer. And there's two ways to log on to this. You would either type in the URL in the browser of a computer, or you can even open up the camera app on your phone, and then you'll be able to hover over. When we display, there will be a QR code that you'll be able to see. So I'm going to pause for just a minute while we get that set up. While we're getting the screen set up and we're displaying that, and again, I'll go over the instructions with you. Oh, wait a minute. We're ready. Okay. So please take a look at the screen right here, and you can see the information in front of you. So what we're going to do is give you plenty of time while our panelists are speaking for you to put in a question. tejoin.com. If you have a browser and you just wanted to type that into the URL area right up there on your browser, you would just type in tejoin.com and then type in that 9-digit, that 594-553-856. And then that'll bring you up to accessing the Thought Exchange. If you want to, otherwise, with your phone, just open up your camera app, and it doesn't matter if you have an iPhone or an Android. I happen to have an Android. Open up the camera app and then hover over that QR code that you see right there. And again, that will bring up the Thought Exchange. So with that, what we're going to do is let the Thought Exchange run while the panelists are speaking. At the end of the panelist presentation, whether that is 15 minutes or 25 minutes, so you'll see a clock countdown, but what we're going to do is when they're finished, we're going to close the Thought Exchange, and then that'll be the opportunity for those top-rated questions, the one in which most people put in the high stars, to be able to be answered by the panelists. So with that said, I'm going to go ahead and turn this back over to Ms. Kay so she can introduce our esteemed panel.
Unmute. I need the t-shirt that I talk about that says you're on mute. Okay, what I was saying was I want to thank everyone for joining us and taking some time this evening to be a part of this conversation and to share your questions via Thought Exchange. And before we jump into those, or before we jump into having each of the physicians take a few minutes to share some things, I wanted to do some brief introductions. So I'm very thankful that we have three physicians joining us this evening. We have Dr. Olivia Cassirier, who, as you all know, is one of our Sacramento County public health officers. She has done a phenomenal job already doing communications outward, working with schools. And as a county team, they are also offering every other week some conversations via Zoom. So if you have not had a chance to participate in one of those, I would encourage you. We'll be sending out that information via some of our FAQs and staff info that we've been sending out, but they're on alternating weeks, so non-board meeting weeks on Thursday evenings. And it's another great opportunity to hear kind of from the county and per the public health perspective of the situation that we're in right now with COVID-19. So thank you, Dr. Kassirier. We also have Dr. Megan Babb joining us this evening. Dr. Babb is the physician of record for Folsom Cordova Unified. She's been working with us for a little over a year. And in addition to being an advisor and someone that I can call and text with some specific questions, she has helped us put our protocols in place for our VFC vaccination clinics and signed off on the EpiPen, the prescriptions that we have to have in place for those to be in our school sites. And she's also just been a wealth of knowledge and a good, calm voice as we've walked through all of this since March. And then we also have Dr. Kimberly Caffarella with us this evening. She is a local family practice doctor. She and Dr. Babb happen to be in the same practice at Mercy Medical Group here in Folsom. And both Dr. Babb and Dr. Caffarella are also parents in our district. And they bring with them years of experience from the medical field. And Dr. Caffarella, in addition to being family practice, she also headed up the local COVID response team. And I just want to say thank you to the two of them for agreeing to share their time with us this evening. And with that, I would ask Dr. Babb or Dr. Caffarella if you could take a few minutes. We did send you some of the kind of themes that we're seeing ahead of time in terms of emerging concerns. And so if one of you would want to jump in and start the conversation, that would be excellent.
Sure. Do you want me to go first, Dr. Babb?
Yeah, I'll follow up after you.
Okay. Can everyone hear me okay? I just want to say thank you first for allowing us to take this opportunity to help and, maybe answer some questions. I'm grateful for our district staff, our teaching staff, and our credentialed and classified staff, as well as our district leadership for taking this on. I know it's been a very challenging situation over the last 6 to 9 months now, and it's a constantly changing endeavor. And one of the things that I've learned a lot in medical practice is that fear is a very powerful motivator, and fear can almost always trump science. And so my role here is really just to help, reassure, help to kind of allay some of that fear where possible, help answer questions so that we can, hopefully get the teachers and staff back safely and the students back safely for in-person learning in a way that's, going to make sense for our students and our families. I think one of the issues that we really wanted to talk about was sort of the emotional and social developments and the issues and problems that we're already seeing for our students, as well as the families, the district families that are impacted by distance learning. And as many of the district staff and teachers are parents and are going through this together at the same time, it's been a challenge for a lot of people. We already have some evidence accumulating that we're seeing increased risks of depression, anxiety, substance use in both the students and the families related to the pandemic. And so one of our biggest concerns is, how can we get kids back into the classroom safely as quickly as possible, where that support is available, where that structure is available. Children are learning, how their communication techniques, they're learning how to interact with their peers and other adults. And those are all things that just really can't happen while they're at home. And so the American Academy of Pediatrics has put out a pretty clear statement that their opinion is that as quickly as possible, we need to get children back to in-person learning as safely as possible. And that being said, there are lots of other factors that we need to address. And so I think our district has, been working tirelessly to put together a plan to do that in a safe way. And so I'm just available here to answer any questions.
Thanks, Dr. Caffarella. I'll just piggyback on to what she has said, and um, most of you are very familiar with this stance that I had taken in the beginning of the year, because so much of what I rely upon in medical decision making is data. My biggest concern as we entered to the middle of summer and getting closer to the start of what would have been the school year for in-person learning was that we just didn't have good data. And so the one thing that I was a big proponent of back in July was time. We just needed more time to understand this, to see how things unfolded. Other states, had made the decision to let their children go back to school for in-person learning, which ended up being a good thing for us, as we were able to watch as things unfolded for them and look at the data. And I think there's been a huge concerted effort by everyone in our communities to really take part in adhering to the public safety measures. It took us a little bit of time to get here, and maybe didn't happen as fast as we would have liked, but nonetheless, we're here, and it's very reassuring to see that our numbers are going down. And that is a very strong correlation with the social distancing, the mask wearing. I was very impressed over Labor Day weekend in terms of the number of outings that people chose not to go on versus 4th of July weekend, which was a very different time for us. So, like Dr. Caparella said, our job here is really to advocate based on what the science and data is telling us. And I think that these 3 months have given us a great amount of data that we just didn't have before. And in addition to that, it looks like these efforts that we're using for COVID are in turn going to be very beneficial in our flu season. And it is looking like that we will have a lower projected number of influenza infections as a result, which is a very positive thing. So again, I'm thank you for letting us be a part of this. And most of us in this office see a lot of you, many of you in Mercy Medical Group, and just know that we are here to support you guys, and really have been thinking very thoughtfully about how to move forward from here. So I'll hand it back to Ms. Kay.
Hello, thank you. All right. We also have Dr. Cassirier on the call. And Dr. Cassirier, if from a public health perspective, I know it's Tuesday, and so that's also when the colors, I'll call them, the colors get updated. And I think we're still in the red, but I think we got good news about that. And then if you wanted to talk a little bit as well, not only about where we are as a county and what that means, certainly we recognize that we are potentially sending students back in the beginning or middle of cold and flu season, and some of your thoughts on that. And then I know our staff out here are concerned about kids naturally, nor do adults, socially distance. And so how might that look in a classroom, if you have some thoughts on that?
Yeah, okay, thank you. And everyone, good evening. In fact, before I start, I just want to make sure I acknowledge Dr. Micah Owen. He's a pediatrician from UC Davis who recently joined our public health team. And we're very grateful because he has been a part of the reviewing the waivers that were coming in and is now actually going to be a part of the team that will respond when we get inquiries from the schools, as well as when we have an outbreak, being able to help respond to that. So hopefully he'll have a chance to talk as well at some point if there are questions that he is able to answer, especially pertaining to some of the protocols for social distancing. So in general, where are we at for Sacramento County? We've come a long way. Fortunately, we're in a much better place than we were at in the spring and summer. In fact, we got a peak in July where we were getting up to 300 cases per day. So that was pretty stressful for everybody. That has come down a lot. We're getting maybe about 100 per day now. We still would like to see that going down, but the good thing is that we're trending in the right direction. The total cases we have right now are 20, at least from this morning, 23,850, and deaths 458, and hospitalizations 77. A couple of things that I try to point out is when you look at the cases, about 60% of our cases are in people, young adults 18 to 49. These are the people who are most mobile, and they're the ones who are working as well. So a lot more exposure in that group. When you look at the age group 0 to 18, it's about only 8% of the population. And oftentimes, that's one of the questions we've been asked is, well, that means that children don't get COVID or that children aren't impacted by COVID. One thing about COVID is right at the start, we closed the schools. So that protected a lot of the children from being exposed. So we are still learning a lot, but right now what we know is kind of limited because children have been at home. And so we are entering into a new phase where we are going to have children going to school. And I know there have been a lot of discussions back and forth. At one time, we were getting a lot of people asking us, why aren't we allowing children back in school? They should be in school. But again, we want to emphasize that the important thing, yes, we do understand the importance of children being in school, but we want to make sure that we do this safely, because we do know that there are a few cases where there could be severe disease. Fortunately, in Sacramento, we've had only 2 that have had the severe reaction to COVID-19. But again, it is still a reality that we want to make sure that we avoid as much as possible. So where are we at right now with as far as with the tier system? The state recently introduced a tier system for reopening, which helps us so that we don't open too many businesses all at the same time, which is what happened the first time that we tried to reopen. So this is much slower. And we started off in the lowest tier, the purple tier, which was the most restrictive. And so schools were not able to open at that time. Then 2 weeks ago, we were able to get to the red tier, which allows, and now at point, we are able to allow schools to reopen. What we are seeing, and we have been working with many of the principals and superintendents, is that they have been very deliberate in their planning, even though now we have told them they don't need for a waiver from us. None of them has been rushing to just go ahead and open all of the classrooms. Many of them are still planning, and what they're looking at is a phased approach to reopening, because they want to make sure that they do this slowly and starting with the youngest group. The reason for starting with the youngest is that at least the limited data that we have suggests that probably the younger children are less likely to transmit to others. And also, I think in terms of impact of distance learning, I think the younger children have been more impacted by not being able to have in-person learning. So the quicker that we're able to get them back into school, the better. So as I mentioned, most of this, the plans that I have seen, the districts are planning to have a phased-in approach. One last thing I wanted to mention before I allow for questions, or also if Dr. Owen has any comment that he would like to make, about one of the questions we've been asked is, why are we opening the schools now when we're heading into the flu season? And yes, we do have concerns about the flu season, but there are things that we can do. And for the flu, one thing that you can do is get vaccinated. So we're pushing that. And from the few clinics that we've had so far, we've gotten a very good response. So we think that people are hearing the message and they are taking advantage of the free clinics that we have available. Also, what gives us some comfort is that when you look at some of the places like Asia that has a much earlier flu season, is been mild. And it's thought that part of that is because the same measures that we take for preventing the flu are actually the same measures for COVID-19 in terms of the social distancing, the hand washing, and the face covering. So our hope is that this will be a mild season, but in addition to that hope, we are still encouraging as many people as possible and as many people that can take the vaccine to be able to get vaccinated. One other thing that we have that will help us with being able to deal with these dual viruses at the same time is that the state has recently informed us that we will be able to get additional test machines for point of care testing. The advantage of this is that if you have somebody who is exhibiting symptoms, say, for example, a child, that we will be able to quickly do the testing in that situation and get results within a couple of hours. So this will help us in being able to sort out the different things that are going on and help us with making decisions. So I am going to stop there. I don't know if Dr. Owen has any comments he'd like to make, and then I'll probably turn it over to Ms. Kay.
Thanks. I don't have anything to add right now, but available for questions too.
All right. Okay. Well, thank you to all three of you. And Dr. Owen, thank you so much for joining us this evening as well. It's great to have you on the schools team and to know that you're out here also willing to answer the questions. And so at this point, our thought exchange has closed. Thank you for everyone for participating and adding your thoughts and your questions. And what we'll do now is this is very much the live part of the, and so based on the ratings, those are the ones that come to the top. And so we have about a little over 30 minutes left in our time together. And so what we'll do is try to go through as many questions as possible. We may not get to all of them, but certainly we have a list of the questions that have been generated. And so we will try to, the ones that we don't get to, we'll try to ask our experts and perhaps address those in a future FAQ out to staff. And so if we're looking at the top themes here, I'm going to start with the first question. If we return to red or purple tiers, should the district shut down and go back to distance learning? And to me, that sounds like a public health question. So either Dr. Kassirier or Dr. Owen, either one.
Sure, so I'll take this one. So right now we're in the red tier. So any counties, red tier, orange tier, or yellow, the schools can be open. It's only in the purple tier that the schools had to be closed. But the way that the state set it up is that now that we're in the red tier and schools are able to start reopening, if, for example, we have an outbreak and we revert back to the purple tier, those schools that are open will not have to be shut. So basically, they will only shut if there is a specific outbreak in that particular school. But the question I've been asked, especially as districts are planning to do it in a phased approach, is say we revert back to the purple tier before, for example, high school is able to open, what would happen in that situation? So technically, that means that the schools that have not opened would have to wait until we're back into the red tier. But then the state has also let me know that they would work with the county. And I'm not sure exactly what they mean by that in terms of working with the county. I'll try to get more specifics because they also know that once you have set a timeline, it makes it very difficult to change it. So, and of course, we would have at least a 2-week warning before we have to go back to the purple tier. So there are things that we can do during that time to make sure that the schools that have not opened will not be impacted. So yeah, if I get more information, I will let you know, but that's where we're at.
Okay, thank you. All right. So our second question, has it been considered that our numbers are going down because schools are not open? And this is there's so it's a two-part question. And what is the mask compliance data in our districts? So does or when do we what do we do when we have anti-masker students? Oh, that's a good question. Dr. Babb or Dr. Caparella, I mean, I know it's also a good one for public health. So I know you all in all of your practices are encouraging families and children to practice wearing the mask so that they can be a part of keeping our numbers down. So who wants to jump in?
Yeah, I can part answer this. Is I think to answer the first question, definitely. I mean, the consideration that especially in the beginning, that numbers weren't maybe going up as high, or we weren't seeing it in kids because they were social distancing and they weren't in school. But again, looking at the data that we have, even though our county hasn't been back at school, many counties around us have been. And so by looking at what they have done and what their COVID numbers have looked like, it appears that their protocols in place to prevent the spread are working really well. The times that we've seen it across the country where we've seen it not work out as well has been earlier, and it was with more of the secondary students, mainly in high school, as well as obviously at the college age. And I'm not sure how to answer the question about the mask compliance data in our district. I can tell you that here in our practice, it is a rule. It is not, we do not let patients come in the building without one. And have had 2 patients that have refused to wear them. But other than that, never have I seen a child refuse. They've actually been the most compliant.
And yeah, I'll add to that a little bit in the sense that, our numbers actually never really got very high in March and April here in Sacramento County. Our biggest surge of patients was actually July, August, and school was closed then. And so, so far what we're seeing, as Dr. Babb mentioned, with surrounding counties and states that are opening up, and many surrounding states are not actually even requiring masking. And the schools thus far do not seem to be sort of a super spreader situation. and that's a good thing. And we're still, tabulating data and learning about that. But I think so far we are cautiously optimistic that the returning to school does not appear to be a cause for an increase in spreading. And as far as the, what to do with anti-maskers, I'm assuming the school district will have some policies on how to manage that for the staff. I think for us, children, do as they see. And so the more we have parents engaged with masking and staff engaged with masking, our practice, we have a large pediatric practice here with small children, and they've been amazingly compliant, much more so, honestly, than a lot of our adult or middle-aged patients. And so I'm not actually as concerned about them keeping their masks on. I think if we're, sort of mirroring that behavior, and I think we're seeing that in other states as well, the students are very compliant with their masking, surprisingly so, actually.
And if I may add to that, in fact, in talking with other health officers, that's the same observation that they have made, is that the children are very compliant with the masking policies, more so than the adults.
Thank you. And I know, for our district, we are doing a little bit differently than some other districts in our area or nearby counties. We are asking all students to please wear their face coverings. And we have asked if there is a medical reason that they cannot, that they get a note from their doctor. And so we've gotten a few of those. And for the most part, they have had a medical diagnosis in there, or perhaps a syndrome that takes place, but they're valid reasons. And in those instances, if possible, we're encouraging folks to maybe wear a face shield. I know that's a good second choice if they're unable to wear the face covering. But certainly that's going to be something that is an ongoing effort, and appreciate the education that the local physicians are providing in their practices to help us all be successful in that. All right, the third themed question here looks like, I am most concerned about returning to the purple tier, but still having to keep schools open. So I think we kind of addressed that one a little bit already, but I don't know if there is anything else that either Dr. Owen or Dr. Casserier want to add.
Dr. Owen, do you want to take it?
I think it's a reasonable concern, and I think the question below it is, how can this be safe? How can this be safe when cases are rising? And I think what we've learned through the waiver process and talking to schools that are planning to open or have opened is, right now no school can totally eliminate the risk of their child attending school. But there's lots of things that schools can do that kind of mitigate the risk and keep their students safe. And I think it's a decision that, each school and each family will have to make kind of individually about what's right for their child, based on what kind of risks the children may have and how comfortable they are with what's happening. But certainly, if cases do rise back to the purple tier or get back to a certain level, then that certainly would change what schools can and cannot do in the future.
Thank you, Dr. Owen. Sorry, I had a little internet glitch there, so I had to switch Wi-Fis. So I didn't hear the complete answer, but I would like to move on to this next question. Exactly what symptoms would warrant quarantine for staff and contacts now that we are entering the flu season? So I think that one maybe is a two-part question. Might be a good question for Dr. Casserier or Dr. Owen to talk about what warrants either an isolation or a quarantine, so our contact tracing process, and then the similarities of symptoms. Perhaps Dr. Babber-Caffarella could talk about those and how, yes, those symptoms cross many different illnesses.
Sure. So I can start off. As far as the criteria for quarantine or isolation, we have a protocol that we have set up that we have shared with the schools where it will make it easy for them to make some quick decisions. And I think the main thing that we try to put across is that we want to err on the side of caution. So any of the symptoms that could be COVID-19, you need to take action right away to make sure that child or that person is isolated from others so that you prevent any additional spread of the disease. The other point is making sure that we have quick access to testing. And as I mentioned, the state recently has informed us that we will have point of care testing, which will help in situations like that. We also have a public health lab and our team that is dedicated to schools that will help in making sure that we have quick access to testing in those situations. And then as far as who goes into quarantine, part of that is based on the cohort system where you're able to identify those that were closest to that person, and those are the only ones that you would put on quarantine. And depending on the situation, especially if you're still waiting for results, you may need to decide to let people go, the students go home for a few days until you are sure of what the results are. Um, and then if it's negative, then make a decision to bring the cohort back. Or if it's positive, then they would go to the full 14-day quarantine. So that's one of the reasons that we ask that there be flexibility in the schedules so that if we have a situation like this, we have as minimal of a disruption to the students' learning as possible.
Thank you. Dr. Caffarella or Dr. Babb, did you want to talk about some of the other illnesses that have similar symptoms?
I'm sure I can take that one, Carrie. I think, from a school and staff standpoint, the symptoms are extremely similar, and thankfully it's really not on the school staff's plate to figure that out. If the child or the staff member, goes to the health office and is screened, and it's felt, that they do have some illness that they need to be sent home for, then it'll be for that child and their family to see their regular physician, and we will evaluate them and determine the cause of their symptoms. And if we determine that there is a cause that's not COVID, then, we'll follow the standard procedures for whatever that illness may be. If it could potentially be COVID, then the child will need to be tested and follow that standard protocol. But the symptoms are very, very similar.
Okay, thank you. All right, next question. Do you think we should postpone the school start date from November to January for elementary school due to the start of flu season? So just so our physicians know, last week at a school board meeting, it was voted upon that our elementary schools would be starting in a hybrid model on November 9, and our middle schools November 30th, and then our high schools January 4th.
I can take this one.
Okay, go ahead.
I think this is a really good question, and I'm getting this daily from parents of kids that I'm seeing. And again, the whole point of delaying the start was, again, for time to lapse so that we could gain more knowledge and more data. I feel very comfortable with the data that we have in saying that I think that we're ready. As long as we keep on the trajectory that we are, I really think that we're ready. I completely understand where the staff and teachers are coming from, because I, along with a lot of other physicians, nurses and clinical staff were incredibly fearful when we went to open up our doors and say, okay, well, we're going to start seeing patients again. There was definitely a fear. But again, it comes down to trusting the data and trusting that we are seeing trends in the positive direction that show us that, okay, if we follow these things, we will be safe. And Dr. Caffarel and I were talking just before the meeting that our clinic and Mercy Medical Group across the board in our area has done an exceptional job at keeping staff and physicians safe and COVID free, because we've simply followed the CDC guidelines. We haven't done anything special. We don't have any fancy equipment. We are not walking around in, big suits that keep us, free from a COVID environment. We are just simply following the CDC guidelines, and they have worked. And so I think that we're ready. And I think that the longer we delay this, the harder it is to just do it. And so I actually think that November is a very appropriate start date for this. And I'm less fearful of flu season this year, mainly because I have patients who are coming who've never had a flu shot in their life, who are showing up and getting flu shots that I'm shocked to see, which is amazing. But those are the little things that are bringing me a lot of hope to see that, look, like, people are really stepping up and making the best decision for our community. And I feel very confident. I feel very confident compared to where I was back in July. I mean, most of you, I talked to a lot of you back then, and you know exactly how I felt. And I don't feel that way at all. I think that we are very prepared. I really do.
I wanted to add to that also is that public health has worked very closely with the school superintendents. And one thing I can say is that this plan has been thought through very deliberately, and that a lot of consideration has been given to making sure that we make the environment as safe as possible. I've also mentioned some of the things that public health is putting in place to be able to support the schools, such as being able to have a school team. I mentioned that Dr. Owen is part of that team. He's a pediatrician, so that the school staff have ready access to nurses and doctors that can help them in thinking through the situations very quickly and making decisions on what needs to happen. I've also mentioned the access to testing readily available and free of charge to the staff. And then also, when we have someone with symptoms, being able to quickly get that person tested as well to make sure that we know what is going on. We have also seen what's happening in other counties, and that gives us a lot of comfort as well in knowing that if we follow the guidelines that we have put in place, that we can provide a safe environment for our students as well as for our staff. I agree with Dr. Bab. I don't think it's essential or required to wear the full garb of PPE, such as gowns and gloves. I think being able to have the face covering and do good hand sanitizing is the most important, and also the 6 feet of separation that will help protect everybody. And then, of course, for situations where someone exhibits symptoms, to be able to act quickly and make sure that person is isolated.
Can I just add briefly too about the gloves in particular? Is that okay, Carrie?
I would love that. Yes, thank you.
Gloves and gowns, but I know for a while, a lot of people were feeling that wearing gloves was a way that they could keep themselves safe. They were wearing gloves to the grocery store and Home Depot. And what we know is that gloves, if anything, just increase transmission of all communicable diseases unless you're actually changing the gloves between every single encounter, which is really not practical for certainly not a school environment. We personally seen patients, we wear gloves only in certain situations, but not in our day-to-day encounters with our patients. We're not wearing gowns when we're seeing patients in the office unless we're seeing our specific sick patients, because we know that those things don't actually help decrease the risk of transmission. And so focusing on the things that we know do increase or decrease the risk of transmission. So our masking, our hand hygiene, potentially a face shield or eye protection if that's another step that you want to take, but primarily washing your hands frequently, using hand sanitizer, and then trying to keep the, at least 6 feet of separation as much as possible, and minimizing the direct encounters. So if you are spending time directly with a child, because obviously with the younger ages, it's very difficult to teach them appropriately if you're not in their space more. But those encounters, if they're brief, if they're less than 15 minutes, we know that that also really helps decrease the risk of transmission. And so those, I think, are the bulk of the things that will help in the vast majority of cases.
Thank you. Thank you, everyone. All right, we're going to go to the next question here. I think we've kind of touched on how safe are we with COVID cases in our class with safety protocols. I know that maybe if we could lump that in with this other question here, if in class teaching, am I also expected to maintain a full 6 foot distance? I'm not sure how to provide meaningful correction or guidance to students if I, as a teacher, am constantly standing 6 feet away. Is closer for shorter amount of time okay?
I can jump in this one. So I think the best thing that we can use to predict what we may see is what is already in place without having to reinvent a wheel. And so again, I'll go back to the what we're doing in our clinic. Upon arriving to a clinic, a patient is getting screened, getting asked questions. They're having a temperature check, and they're taken back into the building if they pass their screening. We have been doing this. Dr. Caffarella was instrumental in getting our protocols put in place at our clinic. And I know she won't take credit for this, but I can say very proud that not one physician, not one staff member from our facility has come down with COVID. And that is largely to do with the protocols that have been put in place. And I can assure you that the protocols that will be in place with the school district are the same. So with the only difference of doing the passive screening. And this is where, we come into the community and rely on the parents. And I think that they're going to be actually quite fantastic about this, about screening their children. I know that there are a lot of parents who have very busy lives and they send their kids to school with a runny nose, but that was in a pre-COVID world. There's been a humbling course that this has taken for a lot of parents, and I've seen it. And I think that screening, along with what is going to be in place, I really believe that you guys are going to be in a situation where you're as safe as possible to minimize the risk as much as possible. We can't eliminate it, right? It's just that will never happen. But we are, I think, in a position now where you guys are going back under the safest conditions that could be. And Dr. Caffarella brings up a good point about this, the distance. Really, what the studies are showing is that a high risk encounter is one in which where you're in an enclosed space with a known individual, a positive individual, less than 6 feet for more than 15 minutes. And so the times that I understand that, especially like, I mean, I've got a preschooler and two kindergartners, so I know how close teachers can need to be. But I have also been, encouraging parents and telling my kiddos about personal space and the distancing, so that they're aware. But I think that for the younger grades, the small encounters that are close are really still going to be minor risk situations.
Thank you, Dr. Babb. I know that we have just a little bit more time here, and I want to see some other questions I think we can address. Let's see here. We've talked about COVID and flu. We have talked about PPE, but I think the next few questions maybe we can blend together, about the cleaning of classrooms and the what would we consider to be a risky surface, perhaps, and protective gear. What do we need to wear? What like cleaning of masks, and we've talked about hand washing. And then I think there were some questions also in there about air filtration. And so if Dr. Kassirier, that's probably a question would be good for you from a public health perspective.
Sure, and probably I'll let Dr. Owen start off because he's been part of the team that's been working on reviewing the waivers. So would you like to say something first?
Sure. As far as the cleaning agents, there is some guidance on the CDC website, and I believe with our schools packet too, that we have received from many of the schools when they submit their waivers about the cleaning supplies that will be used. And what we've seen is people have submitted that they'll be using cleaning agents that have been approved by the CDC for these situations. I think the second question was about PPE, and definitely recommend wearing the face covering at all time. And I think like kind of many of these questions and the questions that came earlier are all very, very related, right? It's all about, risk mitigation. So using approved cleanings between the high risk surfaces would be, surfaces that are high touch, touched a lot frequently during a period of time. And making sure that those get cleaned more regularly. And then as far as PPE, the face coverings and then gloves, potentially when you're cleaning, but like we talked about earlier, not kind of necessarily throughout the day for those.
Thank you, Dr. Owen. Did you have anything else to add, Dr. Kassirier?
Just one last thing about the air purifiers. We do not have any recommendations for those, and neither does the state or CDC. What we have been telling the school principals, is that they probably should consult with their industrial engineer to talk about that, because sometimes it depends on the size of the room. For those that have older classrooms, I guess looking at the HVAC system might be a good idea. But of course, you know what your needs are and what your budget is. So we have not put out any specifications for that or requirements for people to buy any expensive purifiers or HVACs. I think just being reasonable in terms of getting a good system that fits the needs of the size of the classroom, I think is appropriate.
All right, thank you. All right, we're at 6:57, and we're going to keep this to an hour. I know we were going to scroll down, and One final question. There it is, right in the middle of the page. Um, for those physicians who are with us tonight and our parents, are you sending your kids back to school?
I'll go first. I will absolutely be sending my sophomore back to Folsom High School and my 7th grader back to Sutter. Both of them cannot wait to get back to school, to see their teachers in person, to see their friends, to get back engaged in as many activities as they can safely. And they've both struggled. They're great students, they're smart kiddos, but this has been challenging for them. And I mean, kudos to you teachers, because you've had to just reinvent the wheel over and over and over again. And I can't even imagine having to do the things that you guys have done. And so we're super appreciative for the distance learning, but there's just no way for them to learn the subjects they're trying to learn when they're not there together in the classroom. So we are counting the days to November 30th and January 4th.
Thank you. Dr. Babb.
So I have 4 kiddos in the system. I have a 7-year-old, 2 5-year-olds, and a 3-year-old. And yes, I am gonna definitely be sending them back. Not because I want them out of the house, because I am not there all day with them. I haven't had to be the one to do the distance learning. Their distant learning situation has actually been really positive and great. Teachers have been amazing. But they're ready, and I think the system is ready too, to have them back. In fact, my oldest daughter, Sophie, asked the other day, randomly, said, "Mama, I wonder what Miss Walker smells like. I think she probably smells like lavender." And so she's like, they're definitely starting to get excited about it. And I can honestly tell you that had school started in August, and I told Carrie this, that I would not have sent them back in August. I would not have, but now I can very confidently, very comfortably say that I would. And I wouldn't ask any of my patients, or anyone of our community, to do something any differently than what we would do ourselves.
Thank you.
And I would also just add, as well, that I think our district is being very proactive in developing the virtual academy for, those parents and families and staff that maybe returning in person isn't the best option for them because of their health risks or just their own sort of risk tolerance. We all have to kind of do that analysis of what risk are we willing to take. And I think for most of us that are young and healthy, the risks of continuing to keep us home and keep them home is it's just the benefit of returning really outweighs that. So, but that's a decision for each family to make. And so I am grateful that the district has, proposed that option as well.
Me too. Dr. Kasiri or Dr. Owen, I don't know, school-age children?
My kids are in their 20s, but I do have nieces and nephews, and they are all returning to school.
Thank you.
You're on mute. No.
Sorry. So my kids are in daycare, and they go, but I would say that, we took the decision to enroll them very seriously and made sure that we felt comfortable that the facility that they were at were taking all the necessary precautions, and then also closely paid attention to kind of the incidence and prevalence of cases in Sacramento. So I think for our family, like every family, it's a fluid situation. And I think that it depends on, I think, one, making sure that the school for us or the daycare for us was taking the necessary precautions and the recommended precautions, which they definitely are. And then also watching closely what happens with the cases and how they're doing in general. And I think for us, that could change. But for right now, they've been in daycare for a while. And my daughter's young and she wears her mask and she's gotten used to it and she keeps it on all day and it's been going pretty well. So I think I would send them.
Thank you. Thank you. And I'll add, I have also one who will be returning to middle school. She is a 7th grader. And so, yes, our decision, including her in the decision as well, is to return. And then I have a 5-year-old whose school was approved with waiver. And so she's been back in kindergarten. It's an all-day program, and they're doing great. And she's also been wearing her mask. And that's, again, because there was some coaching here at home to be patient, to wear it, and the benefits. And I think I've shared in some other situations, if anyone wants an excellent hand washing lesson, ask that 5-year-old. She's got it down. So I would just want to, it's 7:03, and I want to be respectful of everyone's time. And I want to just extend my appreciation to all of our physicians who joined us tonight, took time out of their professional lives and personal lives to share with us. I hope that questions were answered. I know there were some more questions in the thought exchange that we did not get to. And like I said, we'll try to address those in a future FAQ. And we talked on this call about flu season. And one of the things that we can do to mitigate that is to get your flu shot. I'm proud that we have partnered with Sacramento County Public Health, and we are one of the flu shot locations. And that is available to you all as staff, to our families, and to our students free of cost. It is on November 3rd, so it's a little ways down the road, but that's not too late to get vaccinated. So if you can't get to your primary care, or if you have families or staff who are asking, we'll be sure to communicate that out. But it's at Cordova High School on November 3rd. With that, I want to thank everyone, and this has been recorded, and we will be sharing it out probably tomorrow. So if you have colleagues who were not able to attend tonight, they'll be able to listen and participate tomorrow. Thank you so much, and everyone have a great night.
Hey, Carrie.
Thank you.
The questions that were asked